South Dakota now has more than 100 confirmed cases of COVID-19. The latest update from the State Department of Health shows 101 cases, an increase of 11 since Sunday. The state total includes 34 people who have fully recovered and 1 death. Butte and Marshall counties now report their first cases of COVID-19. The new numbers show minimal to moderate community spread in Clark, Turner, and Yankton counties. That means the exposure in at least one of the positive cases cannot be traced. Secretary of Health Kim Malmstrom-Rysden says the department is considering how to add the location of recovered patients to data on the state website. She expects that update within the week. State Department of Health officials say a new case of COVID-19 in Pennington County is not linked to a Monument Health caregiver who tested positive last week. Monument Health estimates more than 100 employees and patients may have had contact with the caregiver in its Rapid City facility. State epidemiologist Josh Clayton refused to say how many of those individuals have yet been contacted or tested. Clayton says the patients and workers identified so far are advised to quarantine for 14 days and watch for symptoms. Those individuals will only receive testing if symptoms arise. He says just because a person may have been exposed does not mean they'll go on to develop the illness. The CDC says COVID-19 symptoms can appear anywhere from 2 to 14 days after exposure. Symptoms include fever, cough, and shortness of breath. If symptoms arise, individuals can call their healthcare provider to determine if they should be tested. Regardless of test results, officials encourage anyone who's ill to stay home. For South Dakota Public Broadcasting, I'm Jackie Hendry.